Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you all know, this is a webinar where we talk about Lyme disease. This is the first time in a while we've done one of these Zoom or one of these webinars not within the confines of Lyme United. As many of you know, I shut that down about a week ago. So I'm glad that everyone's been able to find me here. And we've got like about 140 or so people signed up for tonight. So that's a good crowd actually for these. We'll have to see how many people actually show up. But anyhow, so I'm glad everyone migrated over here, and I look forward to see what you have in store for me tonight. The way that you participate in these webinars is I take your questions, but I only take questions that are written to me. And so the way to write those questions to me is to use the chat box. Make sure that when you write the question that you send it to everyone, because I want everyone to actually be able to see those questions. And then I'll take them pretty much in the order that they're written. The other thing I will do, because we have a Zoom room here, I can interact with you. So if I need to clarify some points in your question, I will ask you. The other thing is, after I take your question and I do respond, then I'll open it up to see if other people have questions pertaining to that question, not new questions. Okay, I need to really clarify that. The only way you get to have a new question not related to something we already discussed, answered, is to write it in the chat box. All right, so I hope I'm clear on that tonight. And with that, I think we go. Oh, one last thing. I am doing a recording, and tomorrow morning you will be able. I will send an email message out to everyone announcing that it is ready. But you can also find it on the webinars page. All right. And so I just need to show you something. So we've got a new website going on, and I want to show you it to show you where you sign up for webinars in the future, and also where you can watch recordings as well too. So let me just do a quick screen share here. Get rid of that. Okay. So everyone, I have changed Marty Ross MD supplements. Okay. And Marty Ross MD supplements now is a combination of both my supplement store, but also all of the content that was previously on my Treat Line by Marty Ross MD. If you're looking to see articles that I have written, look under this section called Limology Guides. And just to be aware, the reason I'm not using the word treat Lyme here anymore is since I moved all my education content over to a supplement store, the Food and Drug Administration and the Federal Trade Commission do not like it when you say the words treat and a supplement. They don't go together. That violates their rules. So what you'll see is that I've taken the word treat out of a lot of the descriptions of all of my content, but this is the same mega menu we had before where you can look things up, but I'm now calling it Limology Guides, okay? So for instance, if you want to see the Ross treatment protocol, it's right there. That's my Lyme disease treatment protocol, all right? The other thing, just to let you know, site's a little different because there's both products and information here. The way you find information is the search bar up here. If you're wanting to search for products, you click on products, okay? If you're wanting to search for information, you click on this button called guides. So this is a toggle. You have to toggle to what you're looking for information on, either products or Lyme disease information, okay? So just wanted to show that to you too. That's a little bit of a change from before. All right, so then regarding where do you find information on the webinars, it's right here on this Q&A webinars page. And basically through this page, you can sign up for Thursday's webinar. Next Thursdays, I'll repost the link, or I'll put the new link on here after the webinar's over. And then if you scroll down here further, this is where you go to see recordings of our old webinars, all right? And actually, it looks like something got messed up there. There's supposed to be an image of me there, but if you click this button, that's where you'll be able to see the webinars playing, okay? All right, let's see what happened there real quick. Hello, everyone. I'm Dr. Marty Ross. Well, it looks like it works. Another Conversations with Marty Ross MD this morning. Just not sure that the playhead there was supposed to look a little bit different, but all right. Let's see here. Get out of there. All right. So the thing that's interesting about launching a new site, we're still working out some kinks, and you don't realize stuff until you launch, and then you start discovering all these problems. So bear with us through our growing pains. If you're trying to buy some things and things look a little they're not working quite right, please let me know. You can write to me using the email at the bottom of the site to let me know if something isn't going right. We're trying to get it all up and running in a smooth fashion. Okay? All right. So, well, let's go and get started here. So the first question here is from Tracy. And Tracy says, I contacted Pennsylvania Lyme Awareness Organization and asked about a Lyme literate medical doctor whose first name is Ann. They said that that would be Ann Corson. Is that the person you had in mind last week, or is it a different Ann? That is the Ann I had in mind. I think many of you may remember if you were here that one of the members had asked about if I knew of a good Lyme literate medical doctor in Pennsylvania, and I said yes, and she's in Pennsylvania or in she's in Philadelphia, Philadelphia area, and I could not remember her name. So anyhow, that's it. It's Ann Corson. That is correct. Okay. All right. So
Uh,
Tracy, I hope that gave you the information you needed there.
it did, except she's retired.
Darn.
But what I'm wondering is if maybe I could contact her and she could, refer me to somebody else in the area.
You might, I mean, I would Google and see if you could find a website for her and see if she has some contact information on there. I don't know. I actually don't know.
Yeah. Okay.
All right.
I'll give a roll. Thank
All
you.
right. You're welcome. All right. Let's see here. Okay. So the other thing, everyone, when you write your questions, make sure you send them to everyone so everyone can see it too. Okay. It looks like everyone's doing that, but I just wanted to say that. All right. And then David Cecil says, good afternoon from Chico, California. Good afternoon, David. All right. And then hello, Mary. Let's see, Mary. Let's see. Dr. Ross, can Bartonella cause symptoms that mimic a sinus infection, especially following a cold? I'm asking because after starting treatment with Doxy, Zithromax, atovaquone, and tafenoquine, I developed what seemed like increased Bartonella symptoms. My doctor, at my request, then switched me to rifampin and stopped the atovaquone and Zithromax. About a week later, I caught a cold that progressed to what now appears to be a sinus infection. Now I'm experiencing head pressure, congestion, occasional high heart rate, and tingling in my extremities. Could this be Bartonella related? My physician wants to drop the rifampin and start me on augmentin instead. So I have not seen sinus infections caused by Bartonella before, to answer that question. Okay, and knowing how Bartonella infects us, basically it likes to get inside of endothelial cells, the kind of cells that line your blood vessels. It also likes to get into cells that are part of connective tissue and coverings of nerve cells. All right. So where it goes is not even too inside of the sinuses. I know I understand wondering about that, but I would not see it that way. I understand and actually agree with your provider that they want to put you on a different type of antibiotic to treat a bacterial sinus infection, and rifampin would not do that. Augmentin is very good at doing that. Your Zithromax sometimes can help, but is not really that effective. So if you're going to get on an antibiotic that's going to work effectively and hopefully within and trouble with bacterial sinus infections is the sinuses are a closed space, meaning they're not draining out. And so you get infection in there that creates pressure against the walls of the sinuses. And it's in the walls of the sinuses where you have blood vessels that actually bring the oral antibiotics you take that get absorbed into the bloodstream, have got to be delivered to the inside of the sinuses through the blood vessels that line the sinuses. And if there's a lot of pressure that built up there because of the infection filling up that space, it's harder to get the antibiotics in. Therefore, it can often take about 3 weeks or more to clear a sinus infection, even on the right antibiotic. Okay. So, but augmentin would be a good choice for that.
So can I ask a question now?
Yeah.
But then I just started the rifampin, so I feel that I flared Bartonella, and now I have to stop. So I'm left with sinus, symptoms and also Bartonella symptoms, I feel.
Right. Well, let me ask that. So tell me again, I'm not clear I understand. What are you, if you switch over to the augmentin, what will you be on? What are the antibiotics that you'll be on?
Just the augmentin and tafenoquine.
So they left you on the tafenoquine.
Yes.
And so the only thing is, So tafenoquine, I know you're using as a primary agent to treat your babesia, and yes, usually it's better if you use it with Zithromax or a Mepron or something else, okay, that can kill babesia. I can understand why they may have stopped that though, given what's going on with your sinuses too. The only thing you might consider doing, and you talked to your doc about this too, is because you are concerned about losing ground on Bartonella by being off the rifampin, and I think that's a valid concern. Um, you might want to do something herbally at this point to help control some of the Bartonella. And if I were to look at a single agent, there's two single agents you could do. You could do a cryptolepis, which also gives you some benefit on the babesia side. Crypto, according to lab experiments out of Hopkins, is pretty good against growing and persister Bartonella. So you get some coverage there. Okay.
Okay.
Or the other option would be to look at using a cinnamon clove oregano
I
capsule.
use that. I
Yeah.
do take that.
Are you already on that? Okay.
I forgot to say that. Yes, I'm on that.
You're on that. You've got some coverage to help keep the Bartonella from resurging as quickly. If you wanted to get a little stronger at that, you might add Cryptolepis into it because
I
the
have that too. I was planning on doing that, but I just had one supplement at a time.
so if you could cover the Bartonella adequately while you're clearing up your sinuses by doing the crypto and then add in the cinnamon clove oregano or whatever combination. But if you can get on both of the
Okay.
herbs at the same time, I think that might help you then too. Okay.
Okay. All right. Thank you.
Yeah. Good luck to you, Mary.
Thank you.
You're welcome. All right. Hello, Meg. Let's see. Greetings. I have been treating my Lyme and associated Bartonella and Babesia so long, I'm convinced my gut is useless. Wondering how to deal with possible mast cell activation syndrome and still take massive antibiotics, herbal and prescription. Best practices. I have reactions to almost all foods and have been on very limited diet for almost 3 years. I'm losing weight. All right. Meg, can you tell me a little bit about what are you doing to support your gut? What kind of things do you take, like probiotics? Give me an idea what your diet is like as well, too.
Seed probiotics, BPC 157. I'm doing, what else would be in that group? What is it? Saccharomyces.
Okay.
So those are sort of all gut things that I'm doing.
Okay.
Diet, I'm eating mostly red meat,
Okay.
some rice,
Okay.
some vegetables, some steamed vegetables. I can't do gluten, egg, dairy. The nightshades, black pepper. I mean, it's about just about everything will trigger either a histamine reaction or an upset stomach or something
Okay.
else.
So something you might want to consider is, oh, Sally, I forgot to hit your question. I'll come back to you in here in a minute. So Meg, so the things that support the gut are so there's a few things you can do to support the gut. Okay. Number one, you want to make sure that you're putting good bacteria into your intestines and but not just good bacteria that also ferments fatty acids and creates butyrate. Butyrate is a substance made by fermenting short chain fatty acids. Butyrate is a primary fuel source for the cells that line your intestines, and if they absorb them, they can heal back together to remedy leaky gut. Okay, all right.
Okay.
So one of the big thing that happens when you have mast cell activation syndrome, a part of it can be that you've got leaky gut going on.
Mm-hmm.
Right. And, being on all the antibiotics may have set you up. Yeast could, all kinds of stuff can set you up for that, right? But so that everyone's on the same page here, I just want to talk about leaky gut for a minute. So basically, you've got the inside of the intestines, and then you have a layer of cells, which are the intestinal endothelial cells. And then underneath this one layer of cells, and these cells touch up against each other very tight in a healthy intestines, is where your blood vessels run and 60 to 70% of the immune system. All right. And what keeps things from in a healthy intestines, there's no gaps between these cells. And the way that nutrients get from the inside of your intestines to your blood vessels down here is they are micro digested by all the healthy bacteria here. into amino acids and sugars and fats that do not look like the corn they came from or from the red meat that they came from, okay? Because they're broken down so much that it doesn't have any resemblance to the original source that it came from.
Mhm.
Those micronutrients then are absorbed, they're taken up by these cells and they pass through the cells and then they get into your blood vessels. Okay, so essentially, this is a filter. It filters out to keep anything out that we don't want hitting all of your immune cells down here. All right, now, if you've got intestinal yeast, or if you have been on antibiotics for a long time, or if you even maybe Lyme may cause this too, you can get these cells can pull apart and they create gaps. And now, instead of having microparticles being the only thing that gets through here, you can get bigger particles. And that may be small pieces of carbs that kind of resemble corn a little bit, and the protein structures that resemble corn. In other words, you get pieces through that no longer are unrecognizable as a food source. And what they hit is all these immune cells down here, including your mast cells, triggering the mast cells to get active and having all those allergic reactions. Okay. So what you want to do is to try to heal this back up again as best you can.
Mhm.
All right. And so the things that do that, number one, is butyrate. And the way to get butyrate, the best way is to take probiotics that ultimately establish themselves in your intestines and create butyrate. And so the product I like for that is a product that is made by a pendulum called Metabolic Daily. And in Metabolic Daily, there are 5 different probiotics, of which one is called Akkermansia. Akkermansia helps produce, supports mucin production of your intestinal cells. So they create this like gelatin layer across the cells to help them heal. And it's Akkermansia that's your main mucin producer. All right. In addition, it releases a fatty acid called propionate that is then used by 4 other bacteria that are encoded in the metabolic daily to create butyrate. Okay, so it's a good combination. In addition, the Akkermansia seems to promote other healthy bacteria that line your intestines to do better as well too. All right, so you can think of your metabolic daily, especially because it has an Akkermansia in it. The ingredients in metabolic daily should increase your mucin layer, the protective layer over these cells. It should result in greater production of butyrate, which is used by these cells to heal back together. And those probiotics promote the establishment and growth of better bacteria in your intestines, even on antibiotics. Okay. All right. Number 2, you need to make sure you're doing things to feed your good bacteria. And what feeds good bacteria are 2 things. Number 1, prebiotic starch fibers, and number 2, polyphenols. All right, so polyphenols are not technically prebiotic. They actually are not. So prebiotics are actually starchy fibers. And their starchy fibers come from fruits and vegetables, basically, and beans and legumes. All right, that's where they come from. And so if you have a diet where you can tolerate a lot of fruits and vegetables and a lot of beans and legumes, great. You're probably getting enough prebiotic fiber that way. But if you cannot tolerate a lot of vegetables and all that, then what you want to do is you want to take a supplement that is prebiotic. And the prebiotic product that I carry that I have had good results with is something called Mega Pre. It's MEGAPRE. And that is made up of these prebiotic starch fibers. And I usually recommend people take 2 pills 1 time a day on that. All right. And then polyphenols are chemicals that you get from very colorful fruits and vegetables and coffee and chocolate. So those are all rich in polyphenols. Now, if you happen to have, if you're mainlining chocolate on a regular basis, have a lot of caffeine and have a lot of good berries in your diet and all that, great. But if not, then you want to supplement polyphenol. And so there is a product that Pendulum makes called Polyphenol Booster, and the main polyphenols in Polyphenol Booster come from pomegranate, actually. That's their main source of it. So you might want to look at that too, and that would be 2 pills 1 time a day. Okay. So again, now, just make a comment here because a lot of people may be thinking, oh my God, I can never have vegetables and sugars, especially if I have yeast in my intestines. And that's not true. The problem with sugars that you get from your fruits and your vegetables is if they are juiced sugars, they don't have their fiber attached. But when you have whole fruit, whole vegetables, and that's what you're eating, there's enough fiber there that limits the sugar from feeding your yeast, but rather it just makes its way down into your intestine to feed the good bacteria. Okay, all right, all right. So those are the big things I would do. And given how leaky you are, I would keep doing that peptide BPC 157. And again, BPC 157, everyone, is a peptide made by the stomach lining. That's job. The reason the stomach lining makes it is it repairs and keeps the intestines functioning well. We use it in the world of tick-borne illnesses for other reasons too, because we know that it can repair nerves, it can repair muscle and joint pains, it helps the immune system work better. But specifically when people have gut issues like you're having, I think that's a good idea to do too. Okay, all right.
Okay.
The last thing you might want to think about, just think about this. So it gets a little tricky when you have mast cell because everything you take might be something you react to. Okay, but um, research or integrated peptides has a combination peptide product, which is called gut feeling. And inside gut feeling is the BPC 157.
Mhm.
It's also got KPV. So KPV is a peptide that also is useful at stabilizing your mast cells. So it can help with some of that mast cell activation too. Okay. And let me do a screen share here because there's I think maybe one other peptide that's in there too. Hold on a minute. We'll look at it together here. All right. So again, this is back at my store. And so I'm just going to look up gut feeling here. Oops. I forgot to click the right button. There's products. I was looking that just pulled up my guides. Okay, so let's do that again. All right. So here's the gut feeling products. There's one that's unflavored. There's a strawberry one, but essentially they have the same thing. It's just that they have different flavorings. The three of these do. And what is in it? So we've got BPC 157, the KPV, and it also has immune peptide A2, which is something that helps your immune system work better. Okay. And this one also, that's right, I forgot about it. This has probiotics. It's got Akkermansia in it, and it's got prebiotics in it too. I mean, you could look at doing this. And if you were to do this, this would replace your BPC 157. You pick up your KPV, and because this has Akkermansia and something called lactospore, and it's got probiotics in it, you could probably do this as a substitute for that metabolic daily that I was telling you about.
And perhaps in place of the seed probiotic.
Right.
Oh, huh.
All right. So you might want to take a look at that and see what you think. The only problem, from working with these crazy illnesses as long as I did, I tended to be a person that shied away from using combination products, especially
Mhm.
in somebody that has a lot of sensitivities, because the one thing about if you were to take your Mega Pre or your Mega Spore probiotics, or Metabolic Daily, at least you might have a better chance of isolating that as an item you react to, rather than if you have this combination that has all these
Mhm.
things in it. But I just wanted to show you it's a decent
Okay.
product as well too. Okay.
Okay, great.
All right.
Thank you.
Yeah. Good luck to you. Does anyone have follow-up questions to what I was just talking with Meg about? Nothing else, but just what I was talking with Meg about.
Yeah, I have
Yeah,
a question related to the KPV.
sure.
For KPV, should we expect it to work better for leaky gut as an oral capsule,
Mhm.
or can we get similar effects with the oral spray?
That's a good question. So I have not seen head-to-head studies, and I don't know that anyone has. In other words, there are no studies where somebody has, compared the effectiveness of the spray on leaky gut and mast cell activation as part of that and taking the pill. All right. I think, though, that probably the pill might be the better way of going because although the spray is getting, when you spray it goes in the mouth, it's getting absorbed through the blood vessels in the mouth into the bloodstream. Okay. But and some of that then through the blood will spread down to the cells that line the intestines, including the mast cells. But you have a greater chance of getting more direct, immediate exposure to that KPV and your mast cells that line the intestines if you're taking it orally. So I think that's probably the way I would wind up doing it.
Great, thank you.
Yeah, good luck. Good question, by
Yes.
the way. Yeah,
Can I
Meg.
go back to taking capsules? I mean, I'm literally taking about 80 a day. And I just think at this point, my gut is not absorbing any of it.
Yeah.
Um,
Well, you might, if again, if powders are easier, that is that gut feeling is a powder. So that might be
mhm.
something to keep in mind as well too.
Okay,
All
thanks.
right. All right. Good luck. All right. Sally, I saw that that was you that put the heart there to make sure I saw it. I'm sorry I missed your question. All right, let's see. What causes light sensitivity? Does wearing sunglasses all the time cause insomnia? That's a good question. So, light sensitivity is a sign of neurologic irritation, whether it's the optic nerve itself at the back of the eye or the nerves in the brain that that light signal gets transmitted to. It's a sign of neurologic irritation. And we tend to see it in people with Bartonella is one of the people we might see it in. We might see it in people with Borrelia as well too. All right. Sometimes when people have light sensitivity, going with that, just because it's a sign of overall nervous system agitation from these infections, sometimes going in hand with that is also having hearing and auditory sensitivities as well too. All right, so that's probably what the cause of it is. And so basically the treatment is getting your germs under control. Whatever it is that's irritating your nervous system, you want to get that under control. And keep in mind that if you have mold toxicity, that's another irritant on the nerves that might be making it. And so I'd say outside of tick-borne infections, the possibility is with mold toxicity, you might see some of that sensitivity as well too. Okay, all right. All right, so then in terms of wearing sunglasses, sunglasses, yeah, you'll limit light hitting the eyes, which is going to help with the irritation. Um, but I'm trying to think of how to answer this. So, to have good, so one of the things that helps lead to good sleep is something called the circadian rhythm. And your circadian rhythm, which determines when melatonin is released in the brain to put you to sleep, is driven by getting a lot of light in the daytime. And then when things go dark at night, that's what triggers the release of your melatonin, right? So, in theory, limiting light during the daytime may have the effect of upsetting the circadian rhythm, in theory. Okay. Um, to be honest, though, I don't, and I haven't seen any studies on this. Okay. I'm just postulating because you're not getting total light blockage, you're just basically what sunglasses do is they decrease the intensity that you're still getting light. Your brain is still going to know that you are in daylight, not black of night, basically. That I'm not sure if using sunglasses actually disrupts the circadian rhythm. I'd have to actually do a search on that one and see. I don't know off the top of my head, but thinking about it, I don't think it would. Okay. So Sally, did that answer your question for you? All right. Well, let's move. Oh, does anyone else have a follow-up question to what I just asked Sally? Or what Sally just asked me, I should say. All right. Let's move on then. Okay, we get rid of that. Hello, Bill. Let's see. What is your number one protocol for the three Bs, either herbal, antibiotics, or both combined? How long to take it all? All right. So it depends on where you are in your treatment, okay? But in general, it used to be one time in my practice years ago, when I was practicing, that I really thought prescription antibiotics were a better way of going. They were maybe more effective. Okay. And I'll say more about that here in a minute. But more and more, as I've treated and seen the benefit of herbal antibiotics, plus the chances that the herbal antibiotics are not as destructive to the gut microbiome, I've tended to go at the beginning of treatment more with recommending, and ultimately patients decide, right? But recommending to people that they start with herbal antibiotic protocols first, all right? So if we look at, my experience says to me that regarding Borrelia, the chances that any prescription antibiotic protocol that you start on is going to give you benefit is about 85 to 90%. And that is very similar to what I saw with herbal antibiotic protocols. Okay. Now, that means if it's not working well enough, you might substitute something else out. And when you start that new regimen, then that also has an 85 to 90% chance that it will help you. Okay. But generally, for Borrelia, the effectiveness chance that I saw in my practice of herbal antibiotics versus prescription antibiotics is pretty similar. Okay. When it comes to Bartonella, my observation, and again, this is not science, this is my observation, is that, and no one's done the science, okay? So that's the best we have is my observation. But my observation is that herbal antibiotic regimens, any one that you go on, and if it's not working, then you switch to another one, but any one that you try has about a 80% chance of working. I'm sorry, 75 to 80% chance of working herbally, okay? And the prescriptives, I would give about an 80 to 85% chance, any combination, all right? Right. When it comes to Babesia, I think that we're probably talking similar numbers on Babesia too, all right? So you have maybe a 5% less effectiveness out of herbal regimens for Bartonella and Babesia on all comers than you might on prescriptions, but that's not much of a difference. And so I think in my opinion, it's become more important to spare the gut. Now, the reason I say spare the gut, if we look at what's happened in the last, 5 to 10 years, the amount of research that we're seeing now coming out about the importance of gut health and the microbiome and all the things that those bacteria, parasites, viruses, yeast that cohabitate in your intestines do for us. It literally is now, I would describe, I mean, that research has gone up exponentially. And what you can say about that research is, I sum it up this way. I think our gut is the brain of the body. It's the brain of the brain. It's the brain of the immune system. It's the brain of how your muscles work. There are signals that come from chemicals made by a healthy intestinal microbiome that literally direct the function of everything. Okay. And so I call it the other brain. And it's becoming clearer day by day, the importance of that. So because of that, I try to do anything I can at the beginning to spare. Now, I got to admit, at times you may have to go on prescriptions if the herbs aren't working. Okay. So having said all that, my go-to regimen these days when I treat somebody that has the three Bs is I like using a combination of Cryptolepis, Japanese knotweed, and liposomal cinnamon clove oregano. Okay. And here's why. So the crypto plus the clove and the cinnamon clove oregano is a Babesia treatment. Of those, crypto is our strongest herbal option. Clove has a little bit of potential as well too, and this is based on research. I'll show you the table where I'm pulling all of this from in a minute. Okay, right. And the way I would do. Okay, so then for Bartonella, Cryptolepis, Japanese knotweed, liposomal cinnamon clove, oregano, all of them kill growing and persister forms of Bartonella. Plus, the oils and the cinnamon clove oregano are going to break down biofilm for the Bartonella as well too. All right. And then for Borrelia, the crypto, cinnamon clove oregano, and Japanese knotweed is going to go after growing and persister forms of Borrelia as well as biofilm as well too. The oils will go after biofilm. Okay. So the way I dose that is I like people to take 1 pill twice a day of the liposomal cinnamon clove oregano. The Japanese knotweed like people to dose up to 30 drops twice a day. And the cryptolepis, if babesia is involved, I like to dose really high. I like to have people take 5 milliliters, which is a teaspoonful 3 times a day. Now, if you're a person that does not have babesia and you're really just using that triple combination to treat Bartonella and Borrelia, then you can drop your cryptolepis dose down to 2.5 milliliters, which is a half teaspoon 3 times a day, right? So you can decrease the dose, all right? So that would be my starting point basically for those, okay? Now, in terms of if you were going to do this prescriptively, if you could get your hands on tefenoquine, which can be difficult at times, that is our really good babesia treatment these days. And I might couple that with azithromycin, and that azithromycin then becomes part of a Bartonella treatment. And I would then also use fluconazole. And fluconazole, which is a yeast medication, also is very good against Bartonella too. So your Bart treatment then would be azithromycin fluconazole. And the fluconazole in lab experiments is shown to treat persister Bartonella. Also, that azithromycin fluconazole is a Borrelia treatment. The fluconazole will likely pick up cyst form of Lyme, and the azithromycin would pick up spirochete, but you still need to go after persister Borrelia too. And probably I would add one herb to that combination. I would add in some liposomal cinnamon clove oregano because you pick up persister forms of the Borrelia that way, and you help out with persister Bartonella as well too. Okay. All right. So those are my thoughts. Did I answer your question for you?
It did, Dr. Ross. Thanks.
Yeah.
If I could, I guess, follow up. Sorry, I typed another question and a few down. So if you get to this, you could just grab out the queue, please.
Okay. Oh, yeah, go ahead.
So for about the last 2 months, I've been taking knotweed, cat's claw, crypto, artemisia, some ashwagandha, andrographis, the cinnamon clove, L-arginine, curcumin, and milk thistle.
Okay.
Last few weeks, I just haven't been feeling that great, which I'm hoping that that's just the die-off taking place inside my body. About a week ago, kind of on my back, just below my rib cage, kind of started getting kind of like some discomfort back there. And that kind of started spreading down in my flanks. I'm concerned that what I'm taking is affecting my kidneys or my liver, and that's where that discomfort could be, or is that just the part of the die-off taking place? I was curious what your thoughts might be on that.
So in terms of a Herx reaction, let me just make a comment on that. So Herx means you got increased germ killing, usually related to starting something or increasing the dose. All right. But typically, Herx symptoms should start dissipating, declining within about a 2-week period of time if this truly is from a Herx, typically. All right. So have you seen a decline in some of the discomfort back there at all or not?
No, I did increase a little bit on some dosing.
Yeah.
But again, I'm sitting here with this discomfort. I noticed it's definitely there.
Yeah. So if you have increased, then yes, it could be that it's still part of a Herx. Okay. But if you want to be safe, what I would do if you were in my practice is I would want to get just a blood test, make sure how your kidney and liver are holding up to what you're taking. Because if your kidneys are not working well, you'll see some changes in something called a BUN and creatinine level. And then if your liver is not working well, resulting in pain being reflected to the back in that area, you're going to see some elevations of something called an AST and an ALT. So you might see if you can get a primary care provider to go ahead and just do some general blood testing. And also, even though this clearly from a time standpoint seems like it's related to your taking things for tick-borne infections, you know, we get common things that happen to everyone. Sometimes we twist a certain way and we strain the muscles back there as well too, right? And so it could be that provider could examine you and see if they think there's any other thing going on that could lead to that as well too.
Okay. If that kidney function, also like I do show a decreased kidney function or elevated levels in the liver,
Yeah.
what would I do at that point?
You would want to start pulling back on how many things you're taking. And as I said, I would look at a more streamlined regimen. You're taking a lot of germ killers that I don't think you necessarily need to be on right now. I would try to just streamline it back to be, I don't think you need the Artemisinin. I don't think you need Endographis. I think you, as examples, okay? And I think if you were just to pare it back to cinnamon, clove, oregano, crypto, and knotweed and run with that for a bit and see if that unloads the kidneys and unloads the liver and see how that goes for you.
Okay.
Okay.
Hey, Doc, really
Yeah.
appreciate your time.
You're welcome. Good luck to you.
Thanks.
All right. All right. Let's see. Tracy, I see your hand up there.
Yeah, so back to the herbal regimen you just suggested, could you sub out something for the, or sub in something for the cinnamon clove oregano for somebody who's got a sensitive gut? So something else that would be, you know, a little more
Yeah.
gut. Yeah.
Boy, that's tough. So there, I don't know there's going to be a direct substitute, mainly because it's the oil part of that that's great against biofilm, right? So if you're gonna, and that, so the knotweed, I'm sorry, the cinnamon clove oregano is basically picking up all, you know, helping with all three. So if you pull that out, you're gonna be left with the Cryptolepis and the Japanese knotweed. Now, I will tell you, crypto and Japanese knotweed can be a very effective Lyme treatment. It gives it persisters too. It can still be a very effective Bartonella treatment, but you are missing some advantage because the clove also helps with babesia. So you're missing out on that as an advantage, okay? But still, crypto by itself can be pretty good. I think in my practice, if I was managing something like what you're describing, somebody having the same problems, what I might do is stop the cinnamon clove oregano. Um, well, actually, let me go some different step. What I have found that I can sometimes do with people that are having a hard time because of the irritation of the stomach lining from the volatile oils, the cinnamon clove oregano, is sometimes using deglycerated licorice, where you chew a couple of tablets before you take the oils, sometimes makes it so they can tolerate it. Because when you chew licorice, your saliva and chemicals in licorice mix together and form a microscopic gelatinous coat that protects that stomach lining and sometimes makes it easier. So I have found benefit doing that. Have they tried that at all?
I don't think they have.
Yeah.
The other thing is like, you know, the tinctures, the benefit of those is you can titrate up very slowly.
Right.
But the cinnamon clove oregano, you're sort of stuck with the full dosage.
Yeah. Yeah.
So,
No, so you might want to just try, see what happens if they can try the deglycerated licorice. The products I have in my store that have it, there's a sugar-free and a regular product called Rhizinate. It's Rhizin, Rhizinate. I'll show you here in a minute. And you chew a few tablets before you take the pills a couple times a day. I've been able to get people through the irritation by just doing that. Okay. But if you're not able to do that, then you might just try to see how they do just with crypto and Japanese knotweed. But then I would add in a biofilm agent. And what I would probably work with might go with lumbrokinase. And the reason I would look at lumbrokinase is not only do you get some help with breaking down biofilm, you also get some help with Bartonella fibrin nest. Okay. So everyone that's not familiar here, Bartonella has the ability to hide itself under a sugar slime layer, and we call that a biofilm. All right. But also, Bartonella can wrap itself up in blood clotting protein called fibrin, and it creates these fibrin germ nests, and they stick themselves on the blood vessel wall. All right. Now, the difference between a fibrin nest and a biofilm. There's a lot of them, all right? So essentially a fibrin nest is just the Bartonella germ with fibrin wrapped around it. A biofilm is a sugar slime layer that's held together in a skeleton of fibrin. So there's still fibrin there, okay? But this sugar slime layer has a bunch of non-tick-borne disease bacteria living in it that performs all kinds of functions. These are very elaborate structures, basically, all right? But one of the way to break down a biofilm is to try to get rid of that protein skeleton, the fibrin skeleton, by using Lumbrokinase. So you get two advantages by using Lumbrokinase. You get some fibrin breakdown for fibrin nests, and you get fibrin breakdown of the biofilm, and you get some dissolution of that as well too. All right. So the way to use Lumbrokinase is it's a 16 milligram pill or a 20 milligram, depending on the brand. Baluki, Candida RNA makes a product called Baluki, which is a 20 milligram pill. Allergy Research makes a 16 milligram pill. I find they're interchangeable, but some people think one's better than the other. But you want to start those, you want to try to work towards one pill twice a day on that. For those of you considering Lumbrokinase, keep in mind that it is an enzyme that if you have it with other things in your stomach at the same time, it'll try to digest them and then not get absorbed to digest up your biofilm and your fibrin nest. Okay. So I advise people when they take Lumbrokinase to take it at on an empty stomach by at least 1 hour before and 1 hour after, meaning 1 hour before you take it, stop everything. And then 1 hour after you take it, you can resume taking things. While you're in that 2 hour window, water is okay. All right. So those are some things to keep in mind too.
Okay, thanks. And so the persisters would be covered enough by
Yeah, so the crypto and knotweed, based on the Johns Hopkins research that was done a few years, about 4 years ago now, it's very effective against doing the persisters.
Okay, thank you.
Yeah, let me just do a screen share here, everyone. So there is an article that I wrote, and try to get this out of the way. All right, so I'm going to click the guides button there because I want to search the guides. Okay, and there is an article that I have written called on the best herbal antibiotics. There it is. Well, let's see if it'll go. There it is. Okay. So this is the article. And in here, I actually I created a table that looks at what does the research out of Johns Hopkins and elsewhere tell us that these different herbs do. Okay. So Cryptolepis is right here. And under the Borrelia, this G means that it's good at killing growing Borrelia. P means it treats persister Borrelia. Okay. Bartonella is the same thing, growing and persister. And Babesia, it just kills it basically. Okay. Japanese knotweed should be here somewhere. Yeah, right here. There's your Japanese knotweed right there. Again, growing and persister on the Borrelia, growing and persister on the Bartonella, and the part of the Japanese, oh, they say actually Babesia. I don't consider a strong agent against Babesia, but you get some Babesia help there as well too. Okay. Anyhow, and then through here, I talk about how you can put all that information together and come up with treatment options depending on what you're trying to treat. That's all that information down here. Okay. All right. And then in terms of the rhizinate, I just wanted to show you that too. Okay. So these are the two rhizinate products that we've got basically. And again, I would usually chew about 2 to 3 pills on these. Okay. All right. All right. And then let me see. I think those are the big things I wanted to show you here. Okay. Okay, let's go back here. All right, let me move on here. Hello, David. Let's see. Where would I find the article on leaky gut under the new Limology guide? I bookmarked the old article, but now it shows up as 404. Ah, That's because I got rid of it. I'm sorry about that. I streamlined some articles when I had to literally go through every one of the old articles and remove any product identity, product names, and I had to remove the word treat and treatment, okay? Because again, Food and Drug Administration, FTC, say you cannot say a supplement treats a condition. And so when I did that, I started realizing that some of my content in that leaky gut article duplicated what I had in another article. So let me show you the other article where you can find information about leaky gut. And let's do a share here. All right. So back here in the guide section here, if we just, I'm gonna see if it pulls up if I just say leaky gut. If not, I'll tell you how to find it. Okay, yeah. So what I would do is look in this article, which is your guide to a healthy intestine on antibiotics. Okay. And within this guide, so one thing I just want to show everyone too, even though I said that in these articles, I do not use any product names, I can still describe ingredients. And when I write the herbs that might work, the herbal ingredients, I tell you in each article where you can find them. What product categories do I have where you might find some of the ingredients that I talk about in these articles, okay? But there is a section in here that is on leaky gut, I believe. Let's see if it is here. This is a long article, but I try to cover a lot of things that happen in your gut. And somewhere down here, I swear to God, I thought I had leaky gut in here. Gut rehab. Oh, yeah, here you go. So this option 3 about unresolving intestinal yeast overgrowth or unresolving leaky gut symptoms, these are the steps that I would wind up doing. I describe it right here. Okay. So this Akkermansia plus butyrate producers, that is actually a product made by Pendulum, which has these things in it. Is a product by Pendulum called the Metabolic Daily. And again, I would spend a lot of time with that. Okay. All right. All right. And then make sure, again, you're doing prebiotics and probiotics, and I talk about that up here as well, too. Okay. All right. I hope that answered the question for you. Did anyone have a follow-up on that at all? All right. All right. Hello, Rick. Let's see. I was put on ivermectin as a Hail Mary and had the biggest Herxheimer reaction I've ever had. This felt similar to the Herxes from liposomal cryptolepis with excruciating knee pain, but multiplied by 100. I only tested positive for Borrelia burgdorferi. I assumed it was Borrelia related since it was joint related, but as I understand it, ivermectin is not effective for Borrelia. What could cause this reaction potentially indicate? Okay, so what I can share with you is the science tells us that ivermectin treats parasites, okay, certain intestinal parasites. The science, there's one research article that's been done that I've been able to locate when I've looked at this before that says ivermectin may have some anti-babesia properties. Okay. Um, so, maybe from that. Now, the other thing it does, because it kills parasites, it may kill parasites in your intestines. And when you kill some of those parasites that cohabitate in our intestines, that could trigger a Herxheimer reaction with increased inflammatory chemicals that get into the bloodstream and go throughout the body, showing up as joint pain. Okay. So just because you had a Herx on the ivermectin, it may have nothing to do with tick-borne infections. It could have to do with killing of parasites within the intestinal tract that cohabitate there, and then that inflammation showing up throughout the body, basically. Okay, that would be the one thing I would wonder about. What's interesting, though, is that I do know that there are some people that do feel better on ivermectin with their tick-borne infections. And what we tend to see is the literature says ivermectin is actually good at managing cytokines. All right, it can be anti-cytokine, but keep in mind that anti-cytokine effect would be overridden if you're killing something in the intestines, parasites there. At first, you would get a surge on cytokines before the anti-cytokine effect kicks in on that. Okay. Rick, did you have any follow-up question there or comments?
Yeah, I guess maybe it's uh, I shouldn't be attributing it to Borrelia potentially just because I made that attribution just because Borrelia likes the joints and that kind of thing. But you're saying
Yeah.
it's not specific.
No, it's not specific. It's like, for instance, I had, I'll give you an example myself. I had a fish food poisoning of my intestines a number of years ago. And so I got really bad diarrhea, and then eventually that settled down. And even though this was clearly something that was just intestinal, my joints flared up all over the place. I was literally swollen, achy, sore within my hand joints, knee joints, and even my feet joints. Okay. So when you get inflammatory cytokines out of the intestines, either from being infected or killing something in the intestines, those cytokines that you get into your bloodstream and go everywhere. And so it can manifest as joint symptoms as well, too.
Gotcha.
Yeah.
Thank you.
You're welcome. Good luck. Let's see. So, Jeanette, I just want to let you know I don't take email questions. They have to be written here. And again, this format, even though we're here, I can't like review everything about your history here as well too. But so if you want me to respond to something, it would have to be written as a question here so everyone can see it. Okay.
Thanks, Dr. Marty Ross.
Yeah.
I copied the gist of it in here, actually, just looking for any more tools in my toolkit for being able to transition out of my 24-hour fast with less bloating.
Okay.
I just had that experience again today. Like I just had another 24-hour fast. I've been doing fasting for the past year, following Dr. Mindy Phelps with her Fast Like a Girl. And at first, when I started doing 24 hours, it was very difficult to get back on food. And I would immediately just feel heavy in my gut and lots of bloating, constipation, like but I recently started your anti-candida protocol with the Capri Plus, and I'm taking the metabolic daily. And I'm doing a Curamed as well for reducing cytokines. And I think today, after I sent you the email, I was like, oh, things are clearing up a little faster, relatively
Okay.
speaking.
Good.
But I just wonder if I'm on the right road, if there's
Yeah.
anything else I could do.
So have you looked, so if I understand your question correctly, what you're saying is after a 24-hour fast, when you start to refeed yourself again, you get a lot of gassiness and bloating. Is that correct? Okay. Do you
From
outside,
something as simple as chicken broth. Yeah.
yeah. So outside of getting gassiness and bloating when you refeed yourself, do you have other periods of gassiness and bloating at all?
Oh, definitely. Yeah.
And so have you, so these are just quick yeast questions for you. So do you got any ongoing sugar cravings at all?
It was bad until recently. I've been much better actually now. And
Yeah.
I mentioned my tongue was white, now it's yellow.
Okay. So it's
I've been
changing
scraping.
over. Yeah, it's changing. So
Yeah.
what you're saying to me is I wonder if, with intestinal yeast overgrowth, as you start refeeding, I can't quite figure out why it would be with the broth, but anything that would have any kind of sugars in it as you start refeeding are going to be feeding the yeast. And anytime that you stop food and then respond, you can have a stronger reaction than before you start. It's a common phenomenon that we see. I wonder, and I would echo what I think you're trying to tell me is, yeah, you may have just some underlying intestinal yeast overgrowth, and the longer that you treat it, you should become less reactive when you try to refeed again after a 24-hour fast. And it sounds like that's what you're telling me, is that starting to happen. Is that correct?
Yeah, I was actually like, oh, I do notice an incremental,
Yeah.
difference here.
Yeah.
So I'm just wondering, because like I've been learning from you about like taking DGL before taking something that could affect your gut lining, and I'm wondering
Yeah.
if that might be helpful, or
Yeah.
I don't know
I don't
if there
know.
was anything else.
It's hard to say. I mean, the main thing I would say, I would suggest is if you are going to keep doing your intermittent 24-hour fast, that you keep treating for the intestinal yeast and see if over time you are less reactive as you reintroduce food again. Yeah. I don't know that I have a better
Yeah,
solution for
yeah.
you on that. Yeah. Yeah.
Thank you so much.
All right. Good luck to you.
All right, thanks.
Let's see. Rick Torres. Dr. Tanya Dempsey uses diosmin for Bartonella treatment to restore endothelial function. How does diosmin compare to arterisol in general and for glycocalyx repair? Well, that's a good question. Let's look. I'm not familiar with that product, that supplement. We're going to look it up together here. Hold on a minute. I'm going to show you as I'm looking it up. Let's see. Diosmin is a flavone glycoside. Huh. Hmm. You know, I honestly don't know. I don't recognize the herb and what it does. So in other words, I can't specifically comment whether it's better. What I can tell you is that I have seen good results in recommending the arterisol. So everyone who may not be familiar with this, um, so basically your red blood cells or your blood vessels, I should say, are have an internal lining. Well, the inside of your blood vessels is lined by a layer of what are called endothelial cells. And inside of the endothelial cells is a layer called the endothelial glycocalyx, all right? That glycocalyx is kind of a sugary substance. There's more things to it than that, but it has little fibers that kind of stick up into the blood flow. And as blood flows over these fibers, one of the things that causes the endothelial cells and the glycocalyx to release is nitric oxide. And nitric oxide is anti-inflammatory, but it also dilates up your blood vessels so that you get better blood flow deep into the tissues, basically. All right. Now, one of the things I postulate, and I think there's reasons to believe this, and that is that because Bartonella infects the endothelial cells that line your blood vessels, that probably results in dysfunction of the endothelial glycocalyx. All right. Where we have solid science, a similar situation happens is in COVID. We do know for sure that in COVID that the endothelial glycocalyx gets hurt badly by COVID. And because of that, then I started postulating maybe that's happening, especially in some of my Bartonella situations that are just hard to resolve. Okay. And so there's a number of people within Lyme United that were after I started recommending trying it that were reporting good benefits by doing it. So, but I because there's no science supporting it, and because there is no science supporting diosmin, I will tell you, no one's looked at that in science. I think the best I can say is my clinical experience is only with one thing. I don't know how the diosmin works in that regard. Okay. So if you are, where I recommend doing, the product is called arterisol, and arterisol is a product that comes from a type of green seaweed called Monastrum nitidum, and there's an extract from Monastrum nitidum called rhamnin sulfate, and the rhamnin sulfate has got some studies showing that it helps rebuild and improve the endothelial glycocalyx. And so what I've been recommending people to do is if they're in a Bartonella treatment 4 to 6 months in, and they're just having a hard time making headway. In addition to trying to go after biofilms and fibronest by minimally using lumbrokinase, at about 4 to 6 months in, I'm starting to suggest that people try to add in this arterisol product, this extract called rhamnin sulfate in the product called arterisol to support endothelial glycocalyx and giving it a 3-month try. The way that I suggest taking it is to do 2 pills twice a day for a month, and then after a month, decreasing it down to 1 pill twice a day. If you notice good improvements on it, as long as you still have Bartonella infecting your endothelial cells, potentially irritating that endothelial glycocalyx, then I suggest that people stay on it even longer than the 3 months, okay? But by 3 months, you should know if it's going to at least have given you some benefit along the way, okay? All right. And where this is really used a lot is for people that have cardiovascular diseases, high lipids, and maybe high homocysteine levels that have irritated that endothelial glycocalyx. In the cardiovascular literature, there's really good evidence to show that using the arterisol, especially if you have lipid disorders, it can be quite effective at helping to support and repair the injury to the endothelial cells, and even help resorb some of those cholesterol packs that develop there as well too. Okay.
I have I guess a follow-up to that. I have a lot of the the disorders you just named.
Yeah.
I'm about 2 months into the arterisol, but I haven't noted any benefit.
Yeah.
I've taken down the dose like you've instructed,
Yeah.
or recommended rather.
Yeah.
And yeah, would you recommend just continuing this
I would
dose?
I would give it another month and just see. Yeah, I
Okay.
have found at least 3 months is what seems to be a range where you should start seeing some benefits from it.
Okay. Are there any cofactors that you're aware of that could potentially boost or help?
That could help hopefully do what?
Just boost arterisol or just make it work better?
Oh, no, I'm not aware of anything other than taking more. I mean, it is also possible if you're not seeing much benefit is just going up to 2 pills twice a day on that too.
Okay. Thank you.
All right. Good luck to you. Hello, Bill. Let's see. I think we already talked about this. Am I right? Yeah, we did talk about that earlier. Okay, got it. Hello, Ken. I see you you're on the upper right, left-hand corner of my screen. I see you sitting there.
Sound on too. Yeah.
Let me see what you said here. See, Marty, I finally got Igenix, the immunoblot test for Lyme and Bartonella, but now find it hard to interpret the results. Any help with this? So can you tell me what the report says?
Well, the report says for interpretation, this is for the IGX. It says it compares both IGX criteria and CDC NY criteria, and it says 2 or more of the starred bands are present, and that's for a positive. And so
Right.
I thought it was positive for IGX, and then down below it says negative. It does not meet IGX criteria for a positive.
Okay, so so let's go one of the test at a time. So for the Lyme, there would have been an IgM and an IgG antibody test.
Right.
Do you have okay? So tell me on the IgM when you look at they should have put in there they would say 30 they would say 23 or 25, 31, 34, 39, 41 and 83, 93 and they would have said are you positive or negative against those?
It says 2 or more of the starred brands are 23, 31, 34, 39, 41, 93, and then there's a KDA.
No,
And
I
then,
know. But when you look at your results, they should have listed under there what showed up on your test results.
well, that's what I thought they did right there. the IgG serum, they said the IGX criteria, which is IGX, is positive. And then it says on the CDC, one criteria was negative.
Right.
And then below, and it's the same thing. It's a positive, but it says for a positive for IGX,
Mhm.
and then negative does not meet IGX criteria for a positive.
All right. So
And that's
Ken,
IgG.
yeah, I tell you what, it would be helpful is if I could actually see the report. I could probably.
I know that.
Yeah. So what I'm gonna give you I'm gonna give you a one-time chance here. So what I'm gonna do, and everyone, the what I'm offering Ken here, I'm not offering to everyone else. Okay. So Ken, you can email it to me, and I'll be glad to take a look at it for you.
I very much appreciate it because no one in Canada, it was a real chore to get this thing in the first place.
Yeah. No, I'd be glad to. Let you guys something to write down my email with there.
Yes.
Okay, so it's Doc Marty, so DOCMARTY at MartyRossMD.com.
RossMD.com.
Yeah,
I'll send it to you. I very much appreciate that. Thank you.
you're welcome. You're welcome. So yeah, I'll be glad to do that for you, Ken. All right.
Thank you.
So sometime within the 24 hours, I'll try to get your response back on that.
Oh yeah,
Okay.
yeah. Well, I won't get. I'll get it to you tonight, maybe.
That
Thanks.
sounds good. Okay. All right. Let's see. Hi, Grace. Let's see. I have histamine issues and don't tolerate cinnamon or clove in high concentrated doses. What else should I consider for Lyme, Burgdorferi, and Bartonella elizabethii? Can't recall the reason why you don't not a fan of vibrant tick-borne test. That's good. All right, let me address that last part of your question, and then I'll respond to the first part there. So the problem with vibrant, so any independent lab, like IGeneX is an independent lab, Vibrant is an independent lab. These are labs that do not require FDA approval of their test kits, and because they're not selling any of their products commercially, okay? However, IGeneX recently has branded a test they are selling commercially, but just hear me out on this. So whenever an independent lab does a test in-house, they don't have to prove to anyone that their test is valid. If they are going to take their test kit and sell it to another company to use in LabCorp or to use in Quest Diagnostics, then they have to be approved by the FDA. And as part of that FDA approval process, they have to do testing where they show that their test is valid. They're called validation studies. And what's done in a validation study is you take samples of blood where you know which ones have the germ you're testing for and which ones don't have evidence of the germ you're testing for. And you see how good is your test at identifying correctly the ones that have it and the ones that don't. Okay, that's called validation studies. All right. IGeneX does validation studies. Vibrant has done good validation studies on their Borrelia test, but they have not done adequate validation studies on their Bartonella or their Babesia testing. Most of us that have treated this for a long time, many of us just don't trust the results. So even if it's positive, we don't know if that really has any meaning because Vibrant hasn't done what they should have done, which is show us results where they did validations testing about the accuracy of their tests. So I do think their Borrelia test, when it's positive, is accurate, but the method they're using probably is missing it when it's present about 50% of the time. But regarding their Bartonella and their Babesia testing, they've never validated it in a way that makes me believe that it's accurate or not accurate. I just don't know. Okay, so that's why I'm not a fan of Vibrant. Okay, all right. Anyhow, let's see. I have histamine issues and don't tolerate cinnamon, clove, and high concentrated doses. What else should I consider for Lyme? And Bartonella. All right. So again, you could do, and I don't know if you have Bartonella or not because I don't trust the result. But if you're trying to find what you could use to treat Bartonella and Borrelia, you could use a combination of the Cryptolepis I talked about earlier tonight. Oops, somebody's got their microphone on here.
Oh.
Let's see, I'm just muting here one person. Okay. So you could go ahead and do a combination of Cryptolepis at 5 milliliters 3 times a day, along with Japanese knotweed at 2 twice a day. And that's a treatment that those herbs would be useful at treating growing, or I should say managing, to be technically correct for the FDA, FTC here, but managing Bartonella and Borrelia growing and persisters. The lab results tell us they kill growing and persisters in a laboratory setting. Okay, so that's one thing you could look at doing there. Okay, and then number two, see, I'm treating SIBO, SIFO, and mold issues first, as you suggested in the last call, since gut issues are my dominant symptom. I'm currently alternating between oregano, berberine, and caprylic acid. Still have issues with constipation. I want to take binders, but I don't want to exacerbate constipation. Just started on mag oxide today. What are your thoughts on a good binder for mold and heavy metals? Prefer not to take things with pectins, etc., that can flare SIBO. Do you know anything about cytodetox, liposomal zeolite? So I don't know anything about the cytodetox, okay? And then in terms of pectins, my question would be, is have you seen that they do exacerbate your SIBO? I understand in theory you might be worried about that, but do you know that they make your SIBO symptoms worse?
I believe they do. They don't seem to help in any way.
Okay.
Binders make me bloated and constipated, and so
Yeah.
I've tended to stay away from them.
So it's kind of a tricky situation. So when it comes to probiotics, I'm just going to start with probiotics, not prebiotics. Okay. Probiotics, there are some that people with SIBO can use, and other people with SIBO just cannot tolerate garden variety probiotics. So probiotics are okay to use as long as they don't make you worse. They make you feel worse. Okay. Prebiotics like pectin, even though we use pectin as a binder for mold toxins, it's also a prebiotic. It actually is a good soluble fiber that is used by your bacteria and feeds them, okay? But any fibers, prebiotic, notoriously will stir up SIBO, okay? All right. So the problem you're going to run into when I look at in my experience, looking at various things you can do to bind up mold toxins, they range all the way from the prescription cholestyramine, which is extremely constipating, to using a combination products that would have things like activated charcoal in them. They might have some clays like bentonite clay, zeolite clay in them. So you can look at like a GI Detox Plus by Biocide and Botanicals, or you could look at a Mycopole by Research Nutritionals. These are combination products. The combinations I don't find to be as constipating as cholestyramine, but I put their constipating risk like in the middle. Okay, so you got cholestyramine will plug you up, and most people, you've got a medium risk in the Mycopole and the GI Detox Plus product, okay? And then over here on this side, I put on the least likely to constipate you would be the pectin powders. But I understand you're going to have a hard time doing that, okay? Do you have any idea what your mold toxins are that you're trying to bind for?
I know that, let's see, I should have had this in front of me. The patulin, which apparently comes from a lot from apples, which I don't even eat, and dried apples, was really high. Um, There was another one. Most of them were from food-based sources, which is weird because I don't eat grains, and these were all coming from grain sources,
Were they okra
and they were
toxins?
quite high. The patulin was like off the charts,
Are you,
and
do you know if it was,
ochratoxin was one of them as
okay,
well.
okra was too. Okay.
Mhm.
So, are you also, what about aflatoxin? Was that in there too by any chance?
It was moderate, yes, moderate,
Okay.
but
What
I had
you
three very high.
What you may need to do until you can get the SIBO taken care of. And regrettably, some of these illnesses, it's just so hard when you got all these competing things going on to try to thread the needle, right? But one of the things that can help remove some of the mold toxins that will not constipate you and will not flare up your SIBO is sweating. So if you heat up by moving, by sitting in a hot bath, by sitting in an infrared sauna, anything that heats you up is going to cause you to sweat. And when you heat up, heat helps mobilize toxins that are stored in your fatty tissues, moves them into the bloodstream. And about 20, maybe 30% of those toxins that get in the bloodstream will be sweated out. And the remaining portion will go to your intestines and will get moved into the intestines by way of the gallbladder and then get reabsorbed because you can't be on a binder, right? But you can still get some good detox just by sweating and trying to remove whatever you can through the sweating mechanisms as well. So what you might do is focus on what I've done with some of my patients who are really that had difficulty like this would be to have them try to do sweating at least maybe 3 to 5 times a week. And you could do like if you could do a sauna and you could tolerate it anywhere from 15 minutes to 30 minutes 3 to 5 times a week would be a nice way to do it. You may need to build up to that, but you can sweat out some of the toxins, and then therefore you're not having to worry about exacerbating your SIBO symptoms by being on a binder or constipating yourself more by being on a binder as well too.
Okay. We used to have a sauna, but we had to get rid of it because it was in a moldy house that we found out
Yeah.
later. So my husband and I were just talking today about getting a sauna. So I think that's our next step to do
A,
that.
s- yeah, a sauna or a hot tub, or yeah, I mean, in the meantime, you could just fill up that tub full of hot water and sit in it, or sit
You
under a
can't do
very
it
hot
too
stove.
long because I do have POTS, and
Yeah,
so it lowers my
well,
blood
no,
pressure, and I
that's
get the whole mixed bag of things going
no,
on.
that's I understand. Yeah.
Yeah, and so going back to the last part of the question, you don't have any familiarity with Cytodetox or those ingredients that are in it?
No, I'm not. I'm not familiar with it. The zeolite would be a clay, and which may constipate you, to be honest with you. Fulvates, I am familiar with. So the zeolite and the fulvates, I am familiar with those. They can,
Okay.
they both can constipate, unfortunately. Those, yeah, anyhow, yeah.
Okay. But I just started the mag oxide today because mag citrate wasn't doing it for me. So if the mag oxide is effective, then I can go dabble and try some of these other binders again.
Yeah, and you could, and we're again the cyto detox from what's written here might work, or you might look at again at a GI detox plus by biocidin botanicals or a mycopole by research nutritionals. Again, I would give them a medium chance of constipating you.
Okay.
Okay.
Okay, thank you.
Yeah. Good luck. Anyone else have a follow-up to Grace's questions here? All right. All right. Hello, Rick. Let's see. Fry Labs used to provide one of the most comprehensive panels for pathogen testing of infectious diseases. Now that they no longer offer their services to patients, can you recommend a lab with most coverage for pathogen non-specific to tick-borne infections? Rick, I don't have a good idea for you on that one. I'm sorry. Again, I know what Fry Labs offered. Again, many of us questioned what he was really looking at. The validity of what he was doing. and I don't have, I know there's no other lab that has stood in to do the kind of testing he was doing, and I don't know who would be doing that. Okay.
Okay, thank you.
Yeah. Yeah. All right. Let's see. So, Jackie, I know I see your question here, but we are literally about 3 minutes away from me wrapping it up, and that's a lot to do. So I'm not going to be able to take your question right now, unfortunately. Let's see. Katie Ewell says, how can cannabis combined with CBD help with Lyme and co-infections? All right. So CBD has been studied in laboratory experiments, and it has been found in a lab setting to kill Borrelia. Okay. Now, as to whether it actually is effective in humans, I don't know. But I want you to know in theory it could. The other thing that I like about cannabis products and CBD is the benefits they have with pain. They sometimes can be useful with pain. Sometimes they can be useful in helping with sleep. And so it'd be some of those additional things that cannabis and CBD can do that you might get benefit from. In terms of it being a very strong or useful germ killer, even though the lab experiments tell us it can kill Borrelia, I haven't seen good results in terms of killing. And the reason I say that, in Seattle, Washington, where I practiced until a couple of years ago, we had like one of the first laws for medicinal marijuana and then recreational. So I had a lot of patients in my practice that were trying cannabis and CBD, and I just, in terms of more than, it might have helped symptoms, but I did not find it as a useful agent that moved reducing their germ load along. Okay, that would be my comments on that. Okay. If you're interested, there is a whole article I've written on what the potential benefits would be from well, where are we here? Oh, hold on a minute. I'm going all the way back here. So there is an article that I do have on medical marijuana, CBD. I'll just put CBD in here. And this is the article here. And in here, I did review what the science says potential benefits would be for it. Okay. And here's a whole list of things that it has been shown to potentially help. I think in Borrelia, these are my observations and things that might help too. So it can be anti-inflammatory, can help anxiety, depression, nerve pain, muscle and joint pain, insomnia, stomach and intestinal dysfunction, seizures, seizure-like symptoms, nausea, difficulty maintaining weight, spasms, tremors, muscle stiffness, immune function, and it can help decrease reliance on narcotics. Okay. This list of what I wrote here is actually what I did see in my practice as well too. Okay. All right. Any follow-up question to that? Oh. All right, everyone. Listen, we're about 7:30 here. So I'm gonna go ahead and end the webinar tonight. I want you to know I did enjoy being with you here this evening. Tomorrow morning through your regular email, I will send out email notification to everyone that signed up here tonight that the recording is ready to be seen. Okay. And I showed you earlier where you would go and see that recording. And then I look forward to being with you again next week. All right. So also in that email, I will have a link that you can click to sign up for next week's webinar. And on my Lyme Q&A webinars page, that link that I have about signing up for next Thursday will be updated this evening with the link to sign up for next week as well too. Okay. All right. Good night.
Marty, it's Ken. I may take more than a week or more than a day to send it to you, but I will do it. Thank you
I'll
very
look for it. I'll look for it.
Thank you.
All right. Take care.
Thank
Good
you.
night, everyone. You're welcome.
Thank
Bye-bye.
you.
Thank you, Dr. Ross. Good night.
You're welcome. Good night.
Bye, Marty. Thanks.
You're welcome, everyone.